Hello, we will be discussing today eating disorders in adolescence. This PowerPoint presentation is brought to you by Carolyn Santor, Amy Torrance, Christopher Wilson, and Xing Zhao. What are eating disorders? Eating disorders are a group of related conditions that cause serious emotional and physical problems. Each condition involves extreme food and weight issues. Approximately 1 in 20 people will be affected at some point in their lives. Without treatment, an eating disorder can take over one's life, leading to serious and potentially fatal medical complications. Eating disorders are most common in women and most prevalent amongst adolescents. Who is most at risk? Early to middle adolescent. Also, females are 10 times more likely to develop eating disorders than males. Non-Latino white adolescent or young adult females from well-educated middle and upper income families. Parents that had eating disorders, we tend to see this in their children as well. Females who reported depression symptoms were twice as likely as their peers to start overeating or binge eating. Adolescents who were bullied by their peer groups are at greater risk. And problems in family functioning are tied to this disease in adolescent girls as well. Next, we'd like to speak about influencing factors. First, we have here body image. In eating disorders, we do see children with a body dissatisfaction and distorted body image. Oftentimes, this develops in adolescence, which is also the time of puberty, and we do see body changes that are occurring. Parenting, parents' attitudes, parenting styles, and behavior also has an influence. And girls who were sexually active and in pubertal transitions were more prone to disordered eating around this time. Lastly, we'd like to discuss role models in the media. Girls are highly motivated to look like famous figures and were more prone to disordered eating in their quest to become very thin and very skinny, like actresses, models, TV stars that they see day in and day out. Overweight and obese adolescents. We did want to touch on the topic of obesity, which does play a role in eating disorders. Often poor eating habits as a child may add to the possibility of obesity or having an eating disorder later on in life. U.S. children are more likely to be overweight than counterparts in other countries, and being obese in adolescence predicts obesity in emerging adulthood. The percentage of overweight children of 12 to 19 years old in the United States has increased from 11% to 17%. From 1990 to 2010. This is an alarming statistic that continues to rise. Early eating patterns are linked to adult obesity as well. The image here is of a value meal. There are also negative effects, psychological effects of eating disorders that we see: low self-esteem, depression, and problematic relationships. These characteristics may actually develop prior to an eating disorder and may possibly be the cause of an eating disorder, or an eating disorder may begin to develop, which may lead to these characteristics of low self-esteem, depression, or problematic relationships. Next listed here, there's many physical effects that we see related to obesity or eating disorders that we will also get into later on in the presentation, more specifics. But obesity does have a tendency to cause high blood pressure, pulmonary or lung problems, perhaps hip or bone problems, and also type 2 diabetes, which can be prevented in most cases by proper diet and exercise. Most common eating disorders we will be discussing today in great detail include anorexia, bulimia, and binge eating disorder. Anorexia includes self-starvation and preoccupation with dieting. It often leads to excessive weight loss. The involved person has a relentless pursuit of thinness and attains that through starvation. They have an intense fear of gaining weight even though they're underweight. Bulimia involves binging and purging. overeating or consuming large amounts of food, and then trying to rid the body of the food by induced vomiting, exercise, or laxatives. And lastly, we'll be discussing the binge eating disorder, which involves binging, consuming large amounts of food with limited control. Next listed here are behavioral signs and symptoms of anorexia. There's a refusal to sustain a close to normal body weight, intense fear of gaining weight, distorted view of one's body image, and unaware of dangerously being underweight. This is important to look out for as educators or school staff, as we may notice a change in one of our students who may suddenly become thin or may make remarks regarding their weight. You see in the image at the bottom, there's a very, very thin woman looking in the mirror, and all she sees back is a heavy woman. Physical signs of anorexia, there's lists here of early symptoms and later symptoms. Early symptoms include extreme weight loss, a thin appearance, dehydration, fatigue, insomnia, dizziness or fainting, thinning or breaking hair, constipation, or low blood pressure. Later symptoms may include hair loss, bluish nail beds due to decreased circulation, menstruation, which may have already started. Oftentimes, again, this is seen in adolescents. They may have just started with the period, and then the period may go away. Dry or yellowish skin, cold intolerance due to low body weight and no body fat. Irregular heart rhythms, osteoporosis or bone problems. And later on, you may actually begin to see swelling of arms or legs or low blood counts. In anorexia, one starves the body of essential nutrients needed to function. So these are all signs or symptoms of severe starvation. It takes a heavy physical toll on the body due to the low food intake and inadequate nutrition. There's emotional symptoms related to anorexia, which include a fear of gaining weight, irritability, social withdrawal, lack of mood or emotion, depression, fear of eating in public, and obsessions with food and exercise. Oftentimes there's food rituals that are developed, or whole categories of food are eliminated to gain some kind of control. And this also may lead to suicidal ideation or thoughts. Next, we'll be discussing bulimia. Bulimia involves eating or binging on large amounts of food during short periods of time, and then desperately trying to get rid of the food by purging, whether it's self-induced vomiting, laxatives, or excessive exercise. This is oftentimes a response to depression, stress, or low self-esteem. It's also a serious mental illness that does require intervention. In the picture here at the bottom, you can see a cyclic pattern of compulsive eating. You see here somebody may consume 3 sandwiches, including a double cheeseburger, and then decides to rid the body of the food, self-induced vomiting, and then shortly after they may decide to go ahead and consume a large amount of food again, and the cycle continues. This may happen multiple times throughout a day. There's emotional symptoms related to bulimia that includes a low self-esteem, overly linked to distorted body image, feeling guilty or shameful about eating and withdrawing from family and or friends, fluctuation of weight but may stay within normal range due to the nature of vomiting, laxative use, diuretics, or exercise. Again, many times you may see a person affected with bulimia may actually have a normal weight or be slightly overweight due to their consumption of food. They are consuming food, but then they're ridding the body of it through whether it's the purging or laxative use or diuretics or some sort. This is often associated with depression, anxiety, or suicidal ideation. Next here, there's many medical concerns related to the bulimia. Breakdown of teeth, maybe due to the stomach acid. GI problems such as constipation, reflux, ulcers. The cycles of the binging and the purging put severe stress on one's body, especially on the heart. It may cause arrhythmias, palpitations, heart attacks, or may even cause death. Next, here are warning signs that you as an educator or school staff, it's very important for you to watch out for. Students with preoccupation with weight, including fear of gaining weight, difficulty participating in activities that involve food, a fear or disapproval of others that are scared. Students may be scared that other peers or teachers or adult figures may find out about their illness. Sensitivity to references about weight or appearance, guilt, self-disgust, or self-loathing, frequent trips to the bathroom, especially after eating. They may also have bursted blood vessels on their face, cuts or scrapes on their fingers. Food avoidance or dieting behavior. This may be due to a fear of gaining weight, may also be due to the unpleasant ritual of purging afterwards. Fluctuations in weight. Again, we discussed they may actually exhibit a normal weight or normal size, but they're constant dieting because they're consuming large amounts of food and then getting rid of it, and then on a new fad diet, and then off and binging again, consuming large amounts of food, and then back to a fad diet. You may see the fluctuation in weight go up and down, 10 pounds or so within a matter of weeks or months. Lastly is binge eating disorder. This is similar to bulimia without the purging following the large consumption of food. It's frequent binge eating without the purging. Binge eating disorder was just placed on the American Psychiatric Association's classification of psychiatric disorders. This was labeled as a psychiatric disorder in 2013. It is considered a psychiatric disorder still today, and is one of the main top 3 eating disorders that we have today, that we see very often and may see with our students. Symptoms of binge eating disorder involve a loss of control of eating, consumption of large amounts of food in a short period of time, even if you're not feeling hungry or you're already super duper full from a large meal, you will continue to feed and feed and feed. Associated with feelings of embarrassment, disgust, depression, or guilty about the behavior, and there are no attempts to purge or exercise excessively like someone else with bulimia or anorexia. A person with binge eating disorder may be a normal weight, overweight, or obese. There's many medical concerns that also go along with a binge eating disorder. This is due to the weight gain. These medical concerns mimic the medical concerns of obesity, such as depression, anxiety, feelings of guilt, suicidal thoughts, isolation and hiding behavior from others, high blood pressure, diabetes, infertility, abdominal pain, constipation, diarrhea, liver and kidney problems, amongst others. There's many warning signs of binge eating disorders as well, perhaps an overwhelming sense of lack of control regarding eating in secret, avoiding social situations, low self-esteem and embarrassment over the physical appearance, fear of disapproval of others, overly sensitive to references about weight or appearance, anxiety, depression, and or suicidal thoughts may be associated. Many studies out there today on eating disorders. Consistently, they do show adolescent girls with family functioning problems are most affected. This trend does continue today. The physical effects of dieting can change neural patterns and sustain a disorder pattern. Attachment insecurity was linked with body dissatisfaction, a key predictor of these disorders. Only 70% of individuals actually recover from this disorder. About 90% of all bulimia cases are women, and most symptoms develop in late adolescence or early adulthood. Recent studies revealed attachment insecurity was linked with body dissatisfaction, which was a key predictor of these disorders. And studies show playing on sports teams were an important factor in weight control. Where can teens get help with eating disorders? As we mentioned, we chose this topic because you will see this in your school when dealing with adolescents. It is one of the top, the number one psychiatric illness with fatalities is anorexia. You will see students with eating disorders, and it is important that you identify them and get them help right away. We can encourage them to speak to an entrusted adult, perhaps a teacher, a school counselor, school nurse. Perhaps you have a SAP team at your school that you can make an anonymous referral if you don't feel comfortable, approaching the student. Of course, try to urge them to speak with their parents about certain problems. There also is a National Eating Disorder Association, and they have a helpline. It's actually made up of volunteers that are trained to help you find information or help the student find information and support that they're looking for. It's a toll-free number. There's also a click-to-chat option that's instant message if they'd like to communicate that way. Or for crisis situations, there's a number there that you can text to be connected and try to get somebody help if necessary. How can we help prevent eating disorders as parents or educators? Mostly by trying to portray healthy lifestyles. This is very important. We need to be healthy models, healthy role models for our students or for our children. Parents can eat healthy meals together, offer healthy choices for how to lose weight, perhaps just decreasing calories and exercising, engaging your children or students in physical activities, work on healthy projects, or reduce screen time. Especially in the school, we tend to see oftentimes there's rewards for perhaps the most hours of reading in a class, or they're rewarded with a pizza party. Perhaps instead of a pizza party, they can be rewarded with an extra recess time or a walk around the building or go out and get some fresh air, some kind of physical activity. Next here, intervention or treatment. Again, a person with an eating disorder really needs to get treatment. The best recovery outcome is if they get an early diagnosis and begin treatment. The sooner the better. Many times there is also another mental health condition such as depression, low self-esteem, or problems in peer relationships that are going on at the same time or may have even developed prior to the eating disorder. Treatment varies depending on the type of disorder and what other mental health condition is in conjunction with it. There's psychotherapy such as talk therapy or behavioral therapy, group therapy, which you can see here in the bottom right image of people just standing around having a conversation, talking about their problems. Also medicines such as antidepressants and anti-anxiety drugs. Medication itself does not cure eating disorders or may not help to treat eating disorders, but since many patients have underlying issues with other mental health problems, this often does help. Nutritional counseling and weight restoration monitoring is often needed. And most importantly, family-based treatment is very, very important for adolescents because the family is needed to bring this whole circle and ensure that the future healthy eating patterns become healthy and increases awareness and support. Importance to educators. We're discussing this today, eating disorders, because in the United States there's over 20 million women and 10 million men that suffer from a significant eating disorder at some time in their life. Anorexia also has the highest mortality rate of any mental illness. As school educators, we're role models to these students, especially in their adolescent years, where they're most vulnerable. Prevention is key, delivering positive messages about body image and healthy lifestyles. Intervention. If you suspect an eating disorder based on any of the warning signs that we spoke about today, you need to speak up, whether it's to confront the child or student, speak to their parent, the school nurse, school counselor, or referral to a SAP team. encourage the student to speak to their parent or perhaps to go to a trusted adult to talk about their problems. Also, treatment. If and when an eating disorder is identified, perhaps a student may be returning to school, or you may have to assist in some way to ensure that they have a proper plan in place. You may be a part of a team meeting for a healthcare plan, maybe a 504 accommodation plan, or some other accommodations that may be in place if they already have an IEP. Perhaps there's no formal plan at all, but you need to help to support the student and family in need and be aware and just look out for any frequent bathroom trips, food consumption, their overall weight or appearance is very important. Here's a couple links to some videos that we found speaking about eating disorders that may be a benefit to you. And lastly, here's references that we use to put together our PowerPoint and presentation today. We thank you for listening and encourage you to read up about eating disorders and to help your students with this disease. Thank you.